the fluid or the skin up enough that the lymphatics can drain. It's a really good method rather than having to use tight TED hose that constrict. And so we use it also to facilitate movement. We use it for subluxing shoulders and things like that. We're going to show you a patient here pretty soon with the Cerebral system that we use for people with spasticity. The Bioness we're also going to have let's see if Amanda out there. Here comes Amanda. Now you may think Amanda had never had a stroke. And you know what, you're right. But you also may not know she's wearing a brace. She's wearing the Bioness brace. She's a physical therapist here, and she's going to show you what it looks like. How many of you know about the Bioness brace? So you cannot see it, but this is an electrical brace that is stimulating the pickup of the foot. So it's very comfortable, and it actually is helping her. Do you have it on?
I'll show you the controls.
So what it does is, if you have a foot that's balanced, with this electrical device, you can turn it on and it will help pick your foot up. It's very discreet, you can't see it, and it's programmed. So you just carry a little device like this that you carry with you. After this is the programmer, and then thank you. But unfortunately, the insurance companies don't pay for this as often as we like. But where we got a foot that's balanced, poor pickup, this is a really good device. Let's come out here now. I'm gonna, because of our time, I want to keep going here, so I'm gonna have a patient come out here. This is William, one of our patients. And William is, let's bring him out here first, a little bit first, just out here. I want you to see William. He volunteered to be here with us. He's going to go home Thursday. And he's had a stroke that affects his right side. Of course, if it's your dominant side, it's a lot bigger problem to you than the non-dominant. The problem is when it's non-dominant, oftentimes you're neglected more because you are so used to using your dominant extremity. So William has a right. Now you can see here, here's an example of kinesiotaping on his shoulder. This is to help the shoulder that's subluxing or providing pain. People that have painful shoulders, I can't tell you how amazing this stuff can be to relieve shoulder pain in people who have shoulder problems. And it's worse in a stroke because oftentimes the shoulder will sublux. So bring your arm up for us. How far can you come up there? He's right hand dominant. Push your arm out. Make a fist. Or shut it. Bring your arm up. So he has fairly good strength. Open your hand for us. So you can't open his hand very well. It doesn't take much to open your hand. Now try and make a fist. Open. So if you can see this within 2 months, it's best. If you can get some motor, any kind of motor in 2 months, you have a much better chance of recovery. Squeeze your hand. So if we can do that, that's fantastic. Now if I do this, this is spasticity. So when I'm doing this, you can see his hand isn't coming out, it's grabbing. That's what we call spasticity, which we work on with electrical stimulation. Tori here has a little unit that we now sell, or you can buy, and she'll show you how this works.
Sorry, it takes a while to get it to come out. So as you saw, he couldn't open, but then with the stimulation, he can say hi.
So-
what we do is try to work on using the stimulation to help improve the muscle strength, and it helps just get that better range that he couldn't get on his own. So.
And then she's going to actually set him up to show you what the Cerebral Flex is. The Cerebral Flex is another system we use here for working on spastic muscles to, if they can make a little flexion of the wrist, then we are a very involved program with the Cerebral Flex. Water therapy, again, we have a water therapy program here. We really push water therapy because it helps you in your buoyancy. You can do a lot of resistive exercises in water that you can't anywhere else. So if you need a swimming pool, you can deduct it on your taxes. Takes you 7 years, but don't hesitate to do it. And if you need my help, I'll write it out for you. If you need a stair lifter, it's another thing you can deduct. Chair lift, stair lift, elevator, you name it. What you need to be planning. I've been putting them in my house because we don't have any children who's going to take care of us, so I'm putting in everything I can think of to try to be prepared. So water therapy, we don't have a pool, but I have a pond out back I might use. Right now the geese have taken it over, but the body weight system, the light gate is another system that we have that actually suspends the person and allows them to walk. We're looking for getting even a more sophisticated system like this where they can be on a track. There actually is a system called the Sure Hands and other things like it that you can mount in your ceiling, a track that will pick you up, move you to a spot like a commode and set you on it. It's a really nice system, and if you have a house you're going to live in the rest of your life and you needed something like that, it will help people that are very dependent to use. And as you know, one of the things we have here that's very unique is the stroke camp. And this is filled every year. I don't know how many years, 10 years?
20. Going on 20 this year. Woo!
We've been here 21 years, so we've had this 20 years now. This camp is about a 3-day event that they have up here at the
Christian Country Lake Retreat.
Country Lake.
Country Lake. Yeah.
Christian Retreat.
Anybody here been to that? There's some
Yeah.
testimonies. They'll tell you all about most of the people that go. They get on their name on the list the next year, and it fills up fast. So we invite people to go, and we have one for brain injury also. But it's a great opportunity, socialize, fish, and really, it's a wonderful thing. Well, the other thing we have that's unique, I think we have, and not being prejudiced, but I do believe we have the best stroke program in the whole area. I mean, the whole Kentuckiana area. Probably in the state of Indiana or Kentucky.
I agree.
Mainly because we have been allowed to have this free stroke clinic that we have twice a month. And there we have myself, and Tori is our, if Tori goes, I go, because she is such a coordinator and she keeps things rolling, and we have a PT, an OT, and usually a nurse or case manager, and we'll see you for life. If you've had a stroke, we will never let go of you until you're so well that you have to start taking care of us. But so we do that, and we do it on a regular basis, and Tori does a great job about getting that scheduled, and